I'm named Douglas for MetroFocus. New York City public housing is crumbling, and according to the people living there, so is their health. Tenants who live in the NYCHA-controlled apartments say they have to deal with the lingering effects of leaky ceilings, mold, vermin, and a massive roach infestation, all of which they say are having a collective ill effect on their well-being. Making the situation worse, many occupants had to endure this winter's brutal cold without any heat due to a trove of broken boilers. Tenants, low-income housing advocates, and city officials have placed the blame squarely with NYCHA's leadership. Last week, its chairwoman, Shola Ayoteye, resigned amid the swirling controversy. But more concerning than assigning blame are the long-term health effects on the 400,000 people who call NYCHA apartments home. As part of our initiative, Chasing the Dream, Poverty, Inequity, and Opportunity in America, we spoke to those who feel that living in NYCHA-controlled units are literally making people sick.
It wears a lot. You know, when you wake up and you have to smell mold every day. When you wake up, your toilet is not working. When you wake up, you come outside, you see the walls, and you see your tenants saying that their children are sick or they're sick.
Helene Red laments about the living conditions at the Bailey houses in the Bronx.
I have 2 grandkids that lives with me, and I'm testing them for lead tomorrow at their physical. Why should I have to test them for lead?
She and a number of residents took me on a tour of the building, showing me issue after issue and the toll it's taking on them.
We found that a number of the youth who seem to be born in the building have respiratory issues that later become diagnosed as asthma. In this apartment, one resident showed me her water-soaked carpet from a leaky ceiling. Apartment after apartment and tenant after tenant, they told me about
mold.
Mold. It's all over the apartment. It's something that it just grows. I don't know what it is.
It was such a bad leak that they were taking it down, and they had to knock it down and close the water because it was just coming down in gush. They had to take off her mirror and everything that she had here. And this is the results of what they've done and haven't been back.
How long ago was this?
This has been going on for about 6 months already.
This is from 6 months ago?
6 months.
These wet and damp conditions make for a perfect breeding ground for mold and mildew. Lenore Porter showed me the gaping hole from incomplete work in her kitchen and bathroom. How do you take a shower in a wall that's not here?
Well, I do the best that I can. I just take the shower. I'll take my shower, and the water hits the bag. So that's how we take a shower.
No matter what we pay, we are all human first, and then the rest. You know, you have to realize that we are human beings and we are entitled to quality of life.
Within the past few weeks, NYCHA has come in and made repairs. At the Amsterdam houses in Manhattan, work is underway to replace the aging roof. And back at the Bailey houses, the ceiling and wall in the hallway are being patched up. But those address only a small fraction of the problems plaguing NYCHA buildings across the city. Earlier this year, we visited the Red Fern houses in Queens.
You can literally smell the mold as you enter the building. This doesn't need a ticket. Look, it's the primary staircase. That ain't overnight. That look like bread mold too.
Living in poor quality housing has short and long-term health effects.
Dr. Lorna Thorpe is a professor and director of the Epidemiology Department of Population Health at NYU School of Medicine. She's completed extensive research on residents living in public and low-income housing and the relationship to their health. She's been a part of 2 reports on the topic, one in 2012 and the latest in 2015. She says short exposure to these conditions can have an impact, and prolonged exposure makes things much worse and is a detriment to their mental health as well as physical health.
If you're living with exposure to mold, lead, pest infestation, it can have impacts of developing disease like asthma or respiratory problems. And it can also, over time, compound with just the stress of living in an environment that is not healthy and uncomfortable and generally not a positive environment for an individual or a family.
Dr. Thorpe's description of symptoms mirror the complaints from NYCHA residents. The mold, mice, and mildew can be seen and identified, but the unseen stress of the situation is just as problematic.
When you want to come home, you want to live in, be able to sit down and probably read a magazine or watch some TV, and you have to worry about leaks and your toilet overflowing, and you don't have any peace. Your peace is always compromised here.
Bailey House residents have been trying to take a proactive role. The board has partnered with local community groups to try and address health concerns and document issues, and it looks like the course of complaints are getting attention. Governor Cuomo visited the Jackson houses in the Bronx in March to see the conditions firsthand. He's since declared a state of emergency.
As the chief representative of the people of the state of New York, I am sorry for the conditions that you are dealing with. I am telling you that no respectable New Yorker would take a walk through that apartment and allow it to continue.
The governor allocated $250 million in state funds to the agency and appointed an independent monitor to oversee how the money is spent. A shakeup in leadership is coming too. The chair of the Housing Authority is stepping down at the end of April. Charlene Nimmons, founder of Public Housing Communities, says she's cautiously optimistic about what future leadership will bring.
If it wasn't for people like you, MetroFocus and other media outlets, they would have already gone back and sat down and been the status quo, the same as usual. We're now saying time has changed and we need to make sure that the voices of the residents are heard.